HIV infection among MSM and transgender, for example, in Bangkok, the infection rates goes beyond 30%. So if we don't have any good strategies and good program to work with the MSM and transgender specifically, the infection rates could go much higher than this. So talking about other cities, for example, in Yangon, the infection rate is beyond 40%. So and also in Laos, Vientiane capital, the infection rate is 5.6%, which is 300 times higher than general population. So these are examples of major cities in the Greater Mekong Sub-region where MSM and transgender are more at risk of HIV infections. And we need more specific programs and policies to work with the MSM and transgender communities. Yeah, first of all, we could see that the needs of MSM and transgender are actually different. So first of all, we advocate for national programs to distinguish between national MSM program and national transgender program. And stigma and discrimination in the Greater Mekong Sub-region is not actually very obvious. It's hidden in a number of forms of the stigma and discrimination in workplace, in the society, and sometimes you barely know that this is because of your gender identity or sexual orientation. So what we're doing in this region is to work with stakeholders and concerned communities in promoting the understanding of sexual diversity. And in all countries here, we work with the concerned ministries, community leaders, and also other NGO partners to actually to provide the gender sensitivity training, and also to advocate the community or in the society to understand that what gender diversity means. When people understand more, they have less fear. When they have less fear, it will lead to less stigma and discrimination. For the infections among MSM, actually initially people thought that because people don't know about how to prevent HIV because of low knowledge and low uptake for the voluntary counseling testing for HIV, but we figure out later on that this is because of stigma and discrimination that obstruct MSM and transgender people from accessing to essential healthcare services. So even though they know that where to get tested, but they don't have the courage to go because they fear that they will be stigmatized and discriminated by the societies and also the service providers. So that's why they don't go. So for this ICAAP, I believe that we're trying to eradicate or at least to promote the non-discrimination or non-stigmatization services or policies within this region, within Asia and Pacific, so that the vulnerable populations can have a better access to healthcare services. And that would eventually lead to the reductions of new infection rates among the vulnerable population.
Eventually, that seems quite ambitious to think that we're going to get to zero anytime soon, given these high rates. What do you think?
Well, I believe that the getting to zero, people said that it's very ambitious, but I think that we can find a realistic way to achieve that. Because we could see that the infection rates among MSM and transgender is increasing. So we need to do something to achieve that. And at least if we can do something in this region, I think it's good to achieve getting to zero. Although that it's not going to be in time for 2015, but at least we can sustain, or we can hold the infection rates that will be increasing very much further if we don't do anything at all. I think that probably for this I can see that within this region the number of success stories caused by the good and effective collaboration between the civil society sector and the government sector to counter stigma and discrimination against MSM, transgender and LGBT people. So I think that in the coming years, if we have more policies and more programs and more focus on reducing or eradicating stigma and discrimination, I believe that this is a very good pathway to allow MSM and transgender to have better access to essential healthcare services. and that would actually lead to with the better reduction of HIV infection among this population. And also not only for the health issues, but also it will help improve the life quality and also human rights in general for MSM and transgender as well. Because at least they can enjoy or exercise their fundamental rights as of any other human beings. Maybe because it's just that because you don't understand what we are, it doesn't mean that we are not a part of the society. So what we want is not to be treated as more special than any other people. We just want to be treated as equal as any other human beings, and that's it.